Good morning, everyone. My name is Bimpe Kuti, and I am the Service User and Carer Involvement Lead in the Faculty of Health and Wellbeing at the University of Bolton. And with me today, I have one of our service user member, Abi Idowu.
Hello, everyone.
Thank you very much for joining me, Abi, this week. And our plan this morning is to showcase the faculty's strategy on how we involve service user and carer involvement in higher education across various programs within the Faculty of Health and Wellbeing. And we felt that this initiative sits very well with the connecting communities, valuing our differences and learning together. So we both hope that by the end of you listening to this showcase, it will give you additional insight into the various ways in which individuals from various backgrounds are getting involved in their local community in training future health and social care professionals. So what we would like to showcase to you today is an overview of the Service User and Carer Involvement Initiative in higher education and how as a university we've adopted the strategy across various programs in health and social care. You would also have an opportunity to hear from Abi, who is one of our service user member, where she would be able to tell you about the various opportunities and activities she's been involved with as well. And if by the end of this showcase, you are considering or start to think of the opportunities that this initiative could avail to you, then Abby and I can tell you how you can then come on board to get started with us. So why involve service user and carer in higher education? There is a continuous contemporary practice and there is a continuous rationale of why service user and carer should be a part of teaching and learning strategy in the training and development of future health and social care professionals. We also have the mandate from professional regulatory bodies, such as the Nursing and Midwifery Council, where we constantly get reminded of the importance of demonstrating how service user and carer involvement are involved in our programs as well. And the reason why this initiative is being promoted is that evidence has shown, and we see the recognition that service users and carers bring into improving the quality of care services. So their involvement into training before we develop professionals in practice helps drive the desire for us at the University of Bolton to embed this initiative as part of our teaching and learning strategy as well. So how does this work at the University of Bolton? So we already have a fully embedded Suki strategy, which is a part of our teaching and learning framework in the faculty across various programs. We've also been able to, for several years, identify and sustain innovative approaches of how we involve and engage with service users and carers across various programs, but not just doing it as a tick box exercise and replicating the same thing across programs, but being really creative and developing bespoke initiative, bespoke activities that lends itself very well to the profession in which the students are learning on as well. And as a result of that innovative practice, is created further research opportunities and projects where we are able to engage in providing and contributing to the evidence-based as to why the rationale for involving service users and carers in teaching and learning is something very important, and for us to consistently talk about and look for ways to keep increasing the effectiveness of how we engage with this strategy as a faculty. So this slide is just showing you an example of the breadth of opportunities and ways in which our service users get involved. So right from the very beginning, when we decide that we're going to write a program and develop a program, we start having service users and carers involved in the design and development of the program, of its curriculum, service users involved in conversations about the modules, about the students learning on campus and whilst they're in practice, and looking at creative ways, discussing those creative ways and developing those creative ways before we actually even start teaching the program of how service users are going to contribute to the teaching and learning. Our service user and carer involvement initiative has also been very supportive and invaluable to the way we recruit and select students by our service user involvement on interviews and assessment of students prior to them being successfully admitted onto the program. And the various ways in which we teach as well, whether it's lecture format, a seminar where we require having guest speakers, workshop sessions, practical assessments, where there is a summative assessment that fits into their final grade, or a practical session that is just informing their knowledge, and service users involved in role plays and evaluation of how students perceive this initiative on their program, as giving us an opportunity to be very creative in the way we work with our service users. And this example, obviously this list is not exhaustive, but this example of this breadth of opportunities has demonstrated that we have already adopted a collaborative co-production in education initiative in terms of how we work with our service users across the 3 schools within the Faculty of Health and Wellbeing. So we are able to put the voices and the lived experience of service user at the center of the health and social care professional education programs we deliver within the faculty. And the reason we appreciate and we promote this collaborative co-production approach is that our service users injects the reality that as academics, our abstract case studies that we take to class could not have provided to the students. So the depth of experience, lived experience that come with enhances our students' learning experience. And one thing that we wanted to talk about and showcase that we are actually very proud of is we've now been able to become even more creative in the way we merge students from different programs together. So for example, district nursing students having a session with social work students, creating that multidisciplinary professional learning experience and learning sessions by means of our service users who are volunteering their lived experiences of what a district nurse and a social worker would experience, for example, currently in practice, if they get to work together in terms of caring for a service user. So bringing that into that setting, into a classroom, is helping our students to think ahead of their future career, of their future professional practice, and how they can take that learning with them when they go into their placement areas. And again, the reason why this collaborative co-production in education approach is really important to us is, as higher education providers, we know that we have the mandate to demonstrate how service users and carers add value to care professional practice. And that mandate in itself in developing care professional for the future workforce helps us to be very actively interested in evaluating how effective our Suki initiative is in terms of the teaching and learning strategies that we implement. It's also very important to us that we start to extend our understanding of what students learn, how students learn, through their course of engaging with various service users and carers, sometimes from the point of them being recruited onto the program and ongoing, and how that learning shapes and inform the type of care professional that they go on to be in practice as well. So that co-production and co-design approach has been very well established in terms of how we've embedded the service user and carer involvement initiative, adopting bespoke frameworks into different programs as and how it is relevant, but then also looking for opportunities of cross different schools coming together to look at how they can create learning experience between 2 programs and using our service user as a way in to further extending that quality of our teaching and extending the learning experience for our students. So I would like to hand over to Abby now, who is one of our service user member. And Abby will be able to tell you a little bit about our experience of being a service user member and the various ways in which she's been involved as a service user member with the University of Bolton.
Hello, everyone. My name is Abby. I'm a service user, and in my real life, I work in radio. So, how did I get involved in the service user team? Well, I had a long period of illness where I had to stop working. And basically, you know how it is with long term illness, you lose friends, you lose everything. And I felt that I did not have anything else to offer. And I met Bimpe, and Bimpe introduced me to the program. This was roughly about 45 years ago. And I was so certain that I had nothing to offer. And she was insistent that I did. Thankfully, I, listened to her and I came on quite hesitantly because I was certain that I was going to be so underqualified. But honestly, it's the best decision I ever made because I got to be actively involved in the shaping and in the molding of future healthcare professionals using my experience within the system, and not just mine, but of course the entire teams, and even connecting the students to their own experience, because I always say to them, you at one point in time you were also a service user. So think about the time when you were a service user and how you wanted to be, you know treated. Now I'm very much involved from being the very beginning. So things like accreditation, they get to ask us our input in that, and then of course in the interviews and selection of students, and then in role plays, which I particularly love. I usually do that a lot with social work department, and it's just a time to unleash the creativity. Is so much fun. So you're not just teaching, you're learning, and you're having fun in the process. So I'm very much involved in departments like nursing, physiotherapy, um, theater. I do the OSCEs also, and social work, as I mentioned before. And we have other programs that will be coming up that I know that I will be involved in. So it's such a plethora of diversity in the people who come to do the programs. There are people from all walks of life, professionals, people who have done things with their life, traveled to interesting places, been with interesting people, and they come and share their experiences with students who then get to see that these are people and not just their diseases. Because that's another thing that we actually actively work out with the students, that look, it's not just, oh, this person has got this and this and this and this is what you're looking at, but this is a person who has come at their worst time. Because service users don't come to healthcare professionals when they're feeling great. Usually when they're usually feeling horrible that they come. So we get the students to see that these are human beings in front of these diseases. So to be able to incorporate the two. And of course, then things like reviews, because when they're doing their practicals or they're doing their exercises, we get to actually give review on what it is that they've done from the perspective of a service user. So I'm telling you, it is such a I'm so overwhelmed. I can't even get my words out. It's such a fulfilling experience. And if anyone out there who is watching right now is thinking, oh, you know what, that sounds interesting, and it's something I want, and you're being hesitant or you're being afraid and thinking, oh, maybe I don't qualify, please don't stop yourself. We need you. Come. As long as you've gone through the healthcare system, you qualify. Come to us, send Bingwe an email, and I'm telling you, it will be the best decision you've ever made. Not only will you be impacting people, you will learn so much. You will actually have confidence. You will have a better input in your own treatment. Like now, because I'm part of this, I have learned to be an active participant in my own treatment plan instead of just being someone who's being told what to do. And sometimes, very nicely, of course, when you see someone not working in the line of the 6Cs, they say, well, that's not the 6Cs. And then they turn around and look at you like, how do you even know about the 6Cs? But it makes them to mentally adjust. So there's a lot to gain from it, so much fun from it. And it's the best thing you can do, really, especially for our NHS for the healthcare system right now that we have. So thank you so much for listening to me. Really
Yeah.
appreciate it.
Yeah, thank you so much, Abby, for all your comments and your feedback. And I promise I've not told Abby or coached her in terms of what to say, how to say. So she came up with all of that by herself based on how invaluable this experience has been for her. But I always tell them, actually, without our service user members, such as Abby, we wouldn't have been able to create the depth of learning strategy and teaching strategy that we've now been able to take on board and roll with, just because our service users have volunteered their experiences and their time to be involved with us as well. Just to give you a little taster and a demonstration of how the depth of how much we work very closely with our service users in co-designing and co-producing. Some learning package could take months and could take weeks and weeks on end in planning and preparing it to a point where it's now become a package ready for our teaching and learning with our students. So this is an example of some of the detail on the design of how Abby worked with one of our professors in putting together a learning package. And you can see that aspects of Abby's lived experience was put in different parts and in different sections, starting from the very beginning of a story where Abby sat down with the academic staff, co-designing and developing and breaking down elements of her lived experiences into cataloging it in a way that the learning experience is developmental for students. And another thing we were able to do effectively with the lived experience of Abby as an example in this is we were able to link in policies and research and theory that mapped in very clearly into Abby's lived experience. So the students could very see how that policy came to life, how a theory, how a model came to life. They could see research-based evidence that was brought to life in the lived experience of a service user. And I think that's one of the impacts of the quality of learning that our students go on to have. It helps them to then take away transferable knowledge of how to be critical, how to make links, how to make comparisons, how to get into analysis of policies, of research and theory in a context relevant to a particular theme. And because they've done that with the lived experience of a service user, you can almost see them taking that story with them. And weeks after that session has happened, students still refer back to that learning package, refer back to learning points from that service user story and link it to another aspect of what they are learning. So following maybe students going through a full learning package like this, then there is a debrief discussion forum where the students would then have the opportunity to meet the service users real life, either on Zoom or face-to-face now on campus, where they can then extend that discussion and conversation and going back to, oh, you know, part 2 of your story, you know, part 3 and part 4. And can you explain a little bit further what this, how did this happen? How did you experience this? And very quickly, you can see them thinking to their practice, if they're currently in practice, and why that is important for them. And we've been able to now start to gather evaluation around this and the importance of that. So the campus-based blended learning approach we've now adopted by developing the service user online learning packages, the use of technology, working in the co-produced and co-designed way with our service users has really facilitated the way we work with our service users. We're able to provide our service users with more training. We organize monthly drop-ins where we just have a chat and catch up on the various activities that they've engaged in during the month, but also an opportunity to get more academic staff on board to adopt this initiative as part of their curriculum as well. And one thing we are proud of is there is now no borders because of technology in terms of the wider pool of service user membership that we can welcome or invite to join us. So we have service users who are based in Devon, some who are based in Bradford, primarily because we have satellite campuses of our School of Nursing and Midwifery at those locations. But we also have service users in London, even though we don't have a satellite campus there, who are now able to engage as a result of technology. And we are connecting with each other. And through that connection, we are creating something really impactful in terms of how we train the future health and social care workforce. So these are just some of the feedback we've gathered from our students over the years and in recent times as well. The session has been very useful, very encouraging. It's been a different way of learning for them. They can see how transferable those real life situation is to their practice, and they find the online learning package now as an excellent way of learning, which is also very engaging for them. So we want to continue developing across the faculty, across different disciplines, looking for ways to capture service users' experience, but bringing it to life in class, in teaching and learning in higher education. And as a result of that, our students are also identifying gaps in practice. They are identifying what is not working well within the sector, the organization they work in. And that has led us to now approaching some of our practice partners to now actually do some real life research projects that would inform and improve the quality of care that the wider service users within the community receive. And our ambition is to keep contributing to the evidence based around such initiative as well. So in summary, we've seen how meaningful the inputs of our service users are in training care professionals. We also now know, and we've seen evidence from our students that they don't see this just as a tick box exercise. If anything, they request for more. They go through a particular session and you hear students say, oh, why not let's have a service user session around this topic so that we can explore it a little bit more further, so that can help us to think of different things again when we hear it from a service user perspective. That's how aware they are of this initiative as part of their curriculum. So finally, if you are considering being a part of training future health and social care professionals and you are not sure whether you have something to contribute, like Abby said, or you've never even thought of this initiative, you were not aware that this is something that is promoted or something that we are mandated as higher education providers to engage in, please contact me. My email address is here. My phone number is here, and I would be happy to talk you through the various ways in which you can get involved. And again, as little or as often as you want to be involved. Like Abby said, we all have something to contribute as service users who have at one point or another had to use the health and social care system. So thank you so much for listening to our presentation. And Abby and I would look forward to taking any questions or comments you have later on, or even if it's just a feedback, you just want to bring something to our attention regarding this initiative, then we would be happy to do that. So thank you very much. And thank you, Abby, for joining me this morning as well.
Thank you.